very special guest, the chair of the academic board. And as we've spoken about different topics before this podcast, there's a plethora of areas that we could go down into, but we've chosen to go down oral health today in the public sector, and just going to cover a whole bunch of questions, which I'm very excited to talk about. Actually, your name came up from my dentist, funnily enough.
My goodness. Well, I've been teaching dentists since 1985,
right?
Maybe 86.
Yeah.
So most dentists at some point I've met around the state who are still practicing, and I enjoy their company. I've always taught them.
Yeah,
different dental schools.
Yeah, well, she spoke very highly of you.
Cool.
And
pressure now.
This production was recorded at the podcast studios in the Media Arts Centre at Murdoch University. The views and opinions expressed in this podcast are solely those of the hosts and guests and do not necessarily reflect the official policy or position of Murdoch University. Any content provided by the hosts and guests are their personal opinions and are not intended to represent the views or opinions of the university, its administration, faculty, or staff. Now we have that out of the way, let's talk science. Paramount importance.
When did dentistry start? Like, when did humans start looking after their teeth?
Oh my goodness. You can go back, Egyptians, pharaohs, you can go way back, 4,000 years BC, 5,000 years BC. So, teeth have always been part of looking after people. Obviously the care models have changed over the years, thank goodness. Modern dentistry, I think you could probably argue started late 1800s, early this century. So, modern understanding. Well, it came along with the idea of we understand bacteria and, infection and such like. The advent of antibiotics was clearly an important piece of that journey story. 4,000 BC is the starting point, but let's talk modern dental. And then, the whole preventive stuff, you look at, for the turn of the century, year 2000, the CDC in the United States looked at the top public health initiatives of the last 100 years, and fluoridation, bit of a controversial topic now, but we can talk about it. Fluoridation was number 4 on their list. Number 1 was enclosed sewage. So we're not talking technical stuff. We're talking the basics of life here in terms of preventing disease. So, that preventive stuff, early this century, 20s, 30s, 40s, last century, 1920s, 30s, 40s, around that time was when preventive dental really came to the fore.
Right. What do you mean by fluoridation?
Well, the exposure of teeth to ultra-low fluoride levels. And we know that has made a very significant difference to the amount of decay. Just to give you an idea, prior to that process, be it toothpaste, be it water, be it in rice, be it in milk, whatever is decided, prior to low-dose exposure, a 12-year-old would have 12 holes in their teeth, 12 for 12. And today, in Western Australia, 65% of kids are 0, have none.
Oh, really?
And of the rest, only 4% have more than 1 hole in their teeth. So
wow.
12 at 12 to 65, 2/3 are 0, and the rest are fundamentally just 1.
That's a huge change.
It is like off the scale sort of change.
Yeah.
So, and there's all sorts of arguments about what's brought about that change. I think the majority would say, the majority in population health would say, it's be it fluoride from toothpaste, the low dose exposure. And we're talking, in water we talk, 1 part per million. Now, the argument,
So is this saying less fluoride in our water and toothpaste and things, or is it having a little bit of fluoride?
Having a little bit.
Okay.
A little bit. Now, people say, fluoride is poison. Yes, it is. If there was a bag of fluoride on the floor here, you and I'd be dragging you out the door and running from it.
Mm-hmm.
So you don't actually ever see a bag of fluoride like that. That's not how it works. But at ultra low doses, 1 part per million in water, that's the sort of effect you can see in keeping teeth healthy. And it's, I always give the exemplar. If I gave you pure oxygen to breathe in a mask, you'd last about 3 minutes, 4 minutes. So it's always dependent upon dosage, in a sense. So there's been no real solid science to say at those sorts of levels it's not safe. But, there is, as you go higher at the levels, of course, like I said, at the ultimate level, bag on floor, 20 kilos on floor here, run for your life. So, but that's the reality of many drugs that we use and things. So, yeah, a phenomenal change in dental health. So, you could basically look at my lifetime and go from massive decay levels to fundamentally zero in kids now, give or take, in modern society.
You would have played a huge part in that. We just spoke about before with the...
Well, I wished I was not about during the period. Well, I was still a kid. I was about.
Yeah.
I was still, primary school. In Australia, it was about the mid '60s when we started the more broad use of fluoride to do prevention. My journey has been more around looking after that subset that have the significant disease problems still. And we know those kids, just to use kids as the data, we certainly know it's parallels in adults as well. The disease burden has shifted from universally across the population to the poorest parts of our population. So, the poorest half of our population has the vast majority of the disease burden. And socioeconomics is now such a significant factor in many diseases. And, dental disease is an absolute mirror of many other conditions. It's people in poverty, people lacking access to services and care. Those subsets of the population really still suffer. And, a kid from the poorest 20% of the population is 7 times more likely to have to be hospitalised for bad teeth than the rest of the population. So, we're not talking just a little slope like this on the graph. We're talking steep connection to socioeconomics. And so my job, in a way, my journey of the last 30 years has been about addressing the issues faced by the poorest parts of our population and those who can't access good dental care. For example, to give you something, when you actually map out where do dentists work, the highest density of dental practices in the world is in the wealthy suburbs of Sydney.
I'm not really surprised by that.
And then, once you go, if you said, here's a way of looking at it, if you said that the density of dentists in the wealthy parts of Sydney is the right amount, and you said the Northern Territory needs the same, you would need something like a 10,000% increase in the number of dentists in the Northern Territory. It's, the gap is just crazy. You get to the Great Divide, mountain range, and after that, dental deserts as well as environmental deserts. So, some of what we've been working on is to actually address that problem and how do you provide dental care in, locations of small populations, high disease burden. And Aboriginal and Torres Strait Islander people suffer very significantly in this story as well. So providing dental care in those sorts of communities and things.
How have you addressed that? Because you would...
Well, there's a series of ways. So the first thing is when you train a clinician a dentist or oral health therapist or any of the suite of clinicians, when you train a clinician, there are two factors. The longer they spend in a rural area, the more likely they are to work in the rural area. Okay? So if your training is in the country, you are far more likely to work in the country. And the second factor is, if you were born and raised in a country area, you are more likely to go back and work in a country area.
The same country area? Well, I guess
Not
that's
necessarily, but,
just
some reasons,
lifestyle.
yes. Lifestyle. And not necessarily immediately after you're trained. This is in the long haul. So when you take those two factors, you go, well, should dental schools be in Toorak, Nedlands, Double Bay, or should they be in country areas? And so my journey over the last 25 years has been about assisting universities to have new dental schools, and many of them in rural and regional Australia. So Bendigo in Victoria, Orange in New South Wales, Cairns in Queensland have these sites where dental schools are, because then you can use the statistically known drivers of kids from rural background into university and extended exposure in rural practice to drive up dentists in rural areas. And the other part of that is obviously in the city-based dental schools, which, the idea, please, you're not going to close a dental school in the middle of Sydney and move it to somewhere in the country. Never going to happen. Let's get real. But to give placement opportunities to those students in rural Australia to increase their exposure using that data to then say that will increase workforce in the bush. And certainly over the last 30 years, we've done that. That's been my little venture.
I wouldn't say it's
education.
Little.
And certainly, you can see from the data that that's effective. That's effective.
What impact has it had? So you said you've seen from the data.
The first immediate thing to understand is that a dental school can't exist without students actually treating patients. Well, that makes sense, doesn't it? You don't want a dentist released to the world who's never treated a patient. So that means they actually provide quality care whilst in school, whilst in the dental school. So that means where you place the dental school, the population, and you can target it towards the poorest half of the population. Remember my story. You can target to the poorest elements of the community, can have direct dental care provided under strict supervision by competent students directly. And then the art in that is also, you don't build a dental school as one monolithic castle. You build it as 6, 8, whatever number you want, little clinics spread out around regional towns, around the core hub of the dental school. That's what all these new schools are like. So that means that direct dental care provided by the school, let's call it 60,000 visits a year for a dental school, common number, maybe more, 60,000 a year can be provided to the community in the rural area. So there's a direct effect already from these regional dental schools. It's not asking some statistical effect to happen with students then working back in rural areas. But we do know over time that's actually happened. We've seen greater workforce from these graduates into rural areas because that's what happens. So the data's proven again right. And this is not data about dental clinicians. This is data about all clinicians, all continents of the world. It's sort of like that's the way it is. So, they have been successful. I call them my babies. I visit every so often. It's nice. And they're all, I call them teenagers now. They're all off doing their own thing. And sometimes they do things that I look at from over here in Perth and think, oh, my God, what's that doing? But, that's what a teenager does. So, it's been
I can imagine
the
the impact's been, for the community, has been quite phenomenal.
There's also, I'm sorry to interrupt you, but there's also a direct community engagement piece that, you've then put senior supervision clinicians living in those towns as well. And, there's economic value, all the laundry that needs to be done, all the there's direct economic value to have a part of a dental school in your town as well. So, some places have measured that in the hundreds of millions of dollars of impact.
Oh, wow.
So, that's above and beyond the direct care that is provided.
Yeah.
So.
Yeah. The butterfly effect or the flow on effect from all this. Yeah. Talking about money, how, like, a lot of these poverty stricken areas, how do those people get access to the dental?
You know what? We should talk, not just those areas, but we should talk a person in poverty. Dentistry is expensive. So how do people without resources get dental care? Well, the state governments provide dental care at a much subsidised rate for people with, it's different in different states, but in Western Australia it's with a healthcare card, which is the measure below, with a healthcare card, you can have subsidised dental care. Now, yes, there's waiting lists and yes, all the troubles that you find in a public system. It's not easy. Not easy. But you can certainly have subsidised dental care, basic dental care. In rural and remote areas, various states have different models. There are many government clinics built across Australia. I'll make a guess, 150, 200 across Australia. Could be completely wrong, but something like that. It's a lot. And those clinics obviously provide subsidised dental care to people in need. In other places where there might be a private practitioner but no government clinic, the government will often subsidise that practitioner to provide care to people in need. So there is a reasonably wide network. It could be bigger. I wished it was, obviously as this disease burden has shifted to being in poor, the wealthy don't have the disease burden either. So, we've got it's called the inverse care law. We have huge numbers of practitioners in areas where there's little disease. Double Bay, please, but we have few practitioners in areas where the disease is massive. So this is called the inverse care law. We've known about that since the 70s. It's not just dental, it's all sorts of things when you have free market effects in healthcare. So the government does have a network of systems to support people with little resource to access dental care at subsidised rates. Children is different. Children, we have a school dental service. Each state has one. There are slight variations between states. I always say that, don't I? Slight variations between states, which I think is good actually. But school dental services provide basic dental care for all children up to the age of, for different states, call it 15, for free. So as
I remember seeing a dentist
from 6 to 15, care is free. Most jurisdictions, that's irrespective of your income. Some jurisdictions have limited it to people in poverty. But that highly effective systems, they have their ups and downs as well. Different states are better than others, but the reality is that's been part of that journey of, my lifetime's diminishment in pain and suffering and disease.
I can see that this has been a huge impact that you've done in the community for everyone, like good impact. You've made a big change.
Well, not just me,
everyone.
Tens of thousands of people work on this. I'm just
true.
One little cog in a big wheel, geez. But
it's a big phenomenal achievement.
Yeah.
I've got one question. I'm going to step back to the very start because it's been lingering at the back of my mind. How did people figure out about using fluoride?
You know what? Public health is an amazing thing. And I'd say it to everyone. keep your eyes open and watch what's going on around you. You know, the great scientific achievements of this world are often purely observation at the beginning. And this is a classic example in the United States of a dental person working in two towns separated by a distance. Water in those days was collected from wells. In one town, there was natural fluoride from the rocks where the water was, and the other town there wasn't. And purely observational, he's worked out, that's the difference. That's why the dental health is different in two towns.
Who was that?
I can't remember his name.
Yeah.
I knew you were going to ask that.
Yeah.
And I shouldn't I? It's like one of the big things in the journey. But yeah, purely an observational study.
Wow. And that's changed history from then on.
Changed history across the planet.
Yeah.
You know? So yeah.
Yeah.
You know.
Is that, do you know which country that came from?
United States.
Oh, United States. Okay.
Yeah.
Right. And then, all right, let's go to the very beginning and start of how the mouth and teeth and all that work. What are our teeth made of? And is plaque and saliva important?
Three great questions. Firstly, your teeth are an amazing composite of materials. You know, have a think for a minute. What material do you know that will last 100 years being chomped on every single day? Not many materials. And, you know, teeth, I have a great gift at the moment that I have a relative in aged care, and in the dining room are 3 people over 100, all with their teeth.
Wow.
And you're like, I just sit there, you know, I don't sit there and think about it, but I do think about it on the odd occasions that, you know, think about that structural integrity that has withstood.
Yeah. Well, my immediate thought was people with their teeth when they've been buried and they're finding fossils and things. But you're talking about someone that's looked after their teeth for
100 years.
Yeah.
104 years in
that would have been before a lot of these.
That's exactly
dentistry was really
well. Just to give you a fact here, you know, that is phenomenal. I've forgotten it. But in the 1970s, if you looked at 65-year-olds, 80% had false teeth.
Wow.
None of their own teeth.
Yeah.
Today, it's 20%. Completely flipped in 40 years, whatever that is.
Yeah.
So keeping your teeth is now the norm. Having false teeth is extraordinary. And we've seen that in the, you know, training of dentists and things. You know, we used to train them, spend years training them how to make false teeth. And now just the odd bit of training because you don't do many. So, you know, the journey of keeping it. Now, back to your question. They are made of, the outer coat is non-cellular. So it's not like your skin or something has got no cells in it. It's, you know, a crystalline structure. So it's sort of crystals that give it its strength. But the inner parts of it, there's multiple inner layers, are then cellular. And you probably have worked that out because, you know, if you break a tooth or you breathe in on a bit of exposed root of your tooth or something, it hurts. Well, you know, that's because there's cells there and they're sensing it, things. So it's a lovely composite material. It also has the other interesting composite problem of it has to be somehow attached to the bone in which it's sitting. Now, as a little experiment while you're sitting there listening to this, clench your teeth and clench hard and soft. Can you feel your teeth moving? Just a fraction. That's right. Your teeth are not welded to the bone in which they sit. They actually have a little ligament that sits between them that acts as a little bit of a cushioning process.
Is that the root canal?
No, that's in the middle of a tooth, the root canal. This is the periodontal ligament that sits around the tooth. So a tooth sits in a little ligament that holds that to the bone. So the phenomenal cellular approach to how a tooth is held in place is amazing as well. And I only tell that story because I'm going to give one clinical tip today, maybe 2. First clinical tip. If you knock your teeth out, you know, playing footy, tooth gets knocked out, whatever, kid falls over, knocks their teeth out in front of you, 2 things to do. One, if it's a mature enough person, get the tooth off the ground, wash it a little bit, Wash it doesn't mean scrub it, because on the outside of the tooth is still the ligament that attaches it to the bone in your tooth. There, you're looking at live tooth. So don't put your fingers on the root bit of the tooth, just on the crown bit. Give it a quick dip in some milk or wash it quickly and put it back for a competent person. If it's a child or the person is screaming or something, put it in milk and then get help, because the milk will keep the cells on the outside of the root alive.
Wow.
So then you can put the tooth back in and it will reattach
No
to your
way.
bone. So milk. Now, I have been asked, someone else when I did an interview asked, does that include choc milk, strawberry milk? No,
No, the sugars.
just standard milk.
Full cream?
You are regular. People regularly ask me that.
Oh, really?
If you have full cream, yes. If you don't, skim's fine.
Yeah.
Milk. And we put it in milk because the milk has the appropriate ions and proteins to keep the cells alive on the outside of the tooth.
Mm-hmm.
And to give a quirky, fun story, you don't have to put it in a 2-litre drum of milk, because then the poor old dentist at the end has to pour out the drum to find the tooth in the bottom of the drum. You know, a cup is fine, sort of thing, but milk. That's the answer to knocked out tooth. Put it in milk if you can't.
I've
get
never
it back
heard that.
someone's mouth.
That's awesome. What about baby teeth?
Baby teeth we don't put back in.
But does that cell come out when they lose your baby
That's right,
teeth?
exactly.
It does, and it just gets replaced with a new one.
It gets replaced with an adult tooth. So yeah, we don't. If a kid, and often when kids are learning to walk, they fall and they hit themselves on the side of a table or a chair or something, and might knock out a baby tooth. We don't put the baby teeth back because the adult teeth are already forming deep in the bone underneath them.
Yeah, I knocked my teeth out running by the side of a pool when I was 3.
Yeah, that's right.
So,
and they didn't put them back?
No.
Sadly, they go to the fairies. Those ones.
Yeah.
So yeah,
but you can't see the ligament with your own eyes.
No, it's microscopic.
Wow.
But it's living on the outside of that root of that tooth.
That's incredible.
So please don't do what a charge nurse did once. Get some iodine and give it a good scrub.
Oh, this kills everything.
Sand.
Yeah.
Because treat it as a living piece of tissue.
Yeah.
Hold the crown. If you're going to put it back in.
If it's with dirt, though, you would give it a wash.
Yeah. You could whip it under a water tap if that's all you've got. If you've got some milk,
just dip it in that.
in the milk.
Okay.
And then put it back. If it's a competent person who's not going to go,
yeah.
And then you're having to dig it out of someone's lungs. That's not a good sign.
No.
So please, only for competent people. Otherwise, just put it in the milk and bring it in.
Wow.
And time is important. The first question your dentist will ask you when you turn up is we call dry time. How long was that tooth sitting in the dirt or in your fingers before it got in the milk? Keep that as short as you possibly can.
What's the average length of where it's like, well, that's too long out?
That is a very technical question that has all sorts of problems in it. But
like, say if you're like spending like 5 minutes on the ground on the football field trying to
keep at it.
Keep at it?
Keep at it.
Yeah.
10 minutes, keep at it. 15 minutes, keep at it.
Okay. And then the dentist would be able to,
We'll work it out later. But get it in milk.
Yeah.
There you go. That's your clinical tip for the day.
Yeah.
Now, your next question was, what's this whole saliva and plaque story?
Yes.
Firstly, saliva is good.
Yes, I'll do.
Saliva is designed to keep the minerals of your teeth solid. Now, if saliva is not present, rampant decay, tooth destruction, and that happens. Some people have some radiation for a cancer or something that hits the glands that make their saliva. There's tragedy. Now we have some artificial fluids that they can use to mitigate the risk and all sorts of things. Saliva is an important part of your protections. So I'll tell some life hints about that in a little minute. Plaque is just a bunch of bacteria that stick to your teeth. And you've probably noticed it. Everyone's done it. If you haven't brushed your teeth for a day or so, you start to run your tongue over it. It feels furry. That's the beginnings. There's some technicalities, but that's the beginnings of plaque. And those bacteria, as a waste product produce acid. And when they produce acid, that acid will dissolve away the crystals. That's the beginning of decay. So that's why we say, get the plaque off. Now, get the plaque off, depends on where you are, what your cultural history is, how you do that. Obviously the immediate thing that comes to mind is brush your teeth with a toothbrush. Well, in some countries, there are no toothbrushes. In some communities, they don't have the money for it. They will use a piece of bark or a stick. My dad is from Sri Lanka. He tells stories of cleaning his teeth with a stick and coal.
Really?
Crushed up coal to clean. So there's many ways to clean plaque off, but that's the main thing. Get plaque off.
What about mouthwash? Does that affect your saliva?
Mouthwash,
depending on which ones.
Mouthwashes are a complicated story. Well, let's put them aside for a moment.
Okay.
Let's just stick with getting plaque off. Now here, we all talk about a toothbrush. Brush your teeth. Yes, and the question I'm always asked, how often? How often should I brush my teeth? Well, the idea is to get the plaque off at least every 24 hours. So does that say you brush your teeth every 24 hours? No, because you're probably not that effective at doing it. I'm supposed to be good at it. I'm hopeless. So, the idea of doing it multiple times in a day is a sensible protective mechanism to get it off. When? Next question. When? You know what? To some extent, that doesn't matter, except I'll give you a tip. At night while you're asleep, your production of saliva plummets. Plummets.
Does it fall on the pillow? Oh.
Well, to stop it falling on the pillow. So let's not produce it. Makes sense, So that increases the vulnerability of your teeth. So cleaning your teeth before you go to bed to get the acid off is probably a smart move because that's the vulnerable period. I always give one more tip on that journey. It's not a clinical tip. This is a tip of life. In the old days, when you brushed your teeth, you'd use a bit of toothpaste, you'd brush your teeth, and then you'd have a glass on the basin. You get the glass of water, swill it around and spit it out. Throw the glass away. Just spit out the awful bits of the blobby bits of toothpaste in the basin, but leave the residual on your teeth. Because we now know toothpaste has a little bit of fluoride in it, and that fluoride on the superficial parts of your teeth is probably one of the best effective mechanisms of protecting your teeth.
Wow.
So when you brush your teeth, spit out the residual, but don't go rinsing it out to get every little micro drop of
I definitely rinse my mouth.
Well, toss that
time.
cup in the bin. Go home tonight, toss it out.
Okay.
Don't do that. Just spit.
What about brands of toothpaste then?
No. You know what? Use whatever you like.
Really?
Use whatever you like. We have national standards for managing the roughness, and we have national standards for toothpaste. Use whatever you like. Now that, please, use whatever you like. That's enough.
Yeah. I don't want to get you in trouble with like brands and things, but like
no,
like because you see on TV it's like recommended by the dentists and like I guess probably in the last few years.
Can I give you a tip? Brushing your teeth.
Yeah.
Highly recommended.
What about without toothpaste? Still, I guess that's still doing something.
Still doing something.
Yeah.
Yes. If you're gone on a trip and you've left your toothpaste, I've done that regularly. Go away somewhere and go, I've left it home or I've run out. Just brush my teeth.
Yeah. Still does something.
Still something. It disrupts the plaque,
So would natural toothpaste be still better than, say, the other standard brands or?
My only concern about natural toothpaste is it's probably not got any of the fluoride in it.
Okay.
Those natural ones. Look at the packet. If it's got a little bit of fluoride in it, usually in toothpaste we talk about 1 part per 1,000 because, obviously you're only using, that's the other thing. On the TV you see the ads, they put like 4 litres of toothpaste on a toothbrush.
Yeah.
No, please.
Let's just sell more.
Thank you. No, I wouldn't say that, but yeah. Please. A little pea-sized amount is plenty. You don't need gallons of the stuff.
Mm.
And in fact, gallons of, I've tried that. It's awful. You're frothing beyond the
Yeah.
pale. No, just a tiny amount is all you need. You can be frugal with it. Sure, if you've got nothing else, just brush with a brush. Natural ones, please just have a look at the packet. If it's got some fluoride in it, then that's what I'd recommend.
Wow. Yeah, that's something that I've never really looked at before. Like I haven't delved deep into too much about what's in the toothpaste, but I'll grab the natural one, thinking that it must be better. I don't know. It might have fluoride in it or not, but it might not.
Might not. I don't know.
So
don't know the answer.
it's something I'm definitely going to be looking at when I get home.
We do have national standards for toothpaste in this country, so please,
Yeah.
it's
They should
highly
be in there.
regulated.
Yeah. So what about the differences between the standard toothbrush and the mechanical one that goes in circles?
Nice question. All these different variations on toothbrush.
Mm.
There is some data for some people to say that an electric toothbrush, let's call it, battery, whatever, can be more effective. And the reason, the argument is that it actually, people with a manual toothbrush, including myself, are usually pretty slack. You just sort of go, and you're half asleep and, oh yeah, I've done a good job. And the reality is you probably haven't. So an electric toothbrush assists with making sure you optimise the clearing of plaque off your teeth. So there is some argument for that. But please, I'm still a manual toothbrush user. There's nothing wrong with a manual toothbrush. What's wrong is not using anything.
Or is it the method as well? Because the dentist I go to says that I've could improve my method. Sometimes I've been too harsh. And then the other times it's like you got to be reaching this area and brushing in this circular motion.
Well, firstly, the point is make sure you cover all the surfaces. Actually be strategic about getting the brush. Think about the outside surfaces, the inside surface and the biting surfaces and just think through that you're covering each surface with your brush. Yes, we can now argue about bristles at 47.26 degrees or whatever it might be, but, pragmatically, plaque sticks first towards the gum line on teeth. So make sure you get towards the gum line as you clear.
Okay.
As you clean. So I think your dentist probably said, hold the bristles at a bit of an angle.
Yeah.
Downwards towards your gum. Yeah, well, that's good. That's trying to aim it at that gum line.
And a bit of a circular motion.
But you know what?
Whatever works.
Circles, whatever works.
Okay.
But I think the emphasis is be systematic and think that you are actually removing plaque from your teeth.
Yeah.
Be systematic.
Think about it. Visualize it. Yeah, that's a good way. I don't think I've actually visualized when I brush my teeth. I'm just kind of like...
Yeah, just automated. Yeah. I count. So obviously I've got, 4 external surfaces and 4 internal surfaces. So I just count to 8, make sure I've done all 8.
Yeah. Okay. That's what method.
1, 2, 3, 4, inside, 1, 2, 3, 4.
Yeah.
Clear. Now, obviously the biting surfaces get it in the mix, so to speak.
Yeah.
But, I just have my 8 count.
Yeah.
But I'm quite a mathematical person. I'm into numbers.
Well, some people work better like that, to have a bit of a method going through it. And I think I'm definitely one of those people as well. This leads into my next 2 questions. On my question sheet here, we're going all over.
Yeah,
there's no method. So I just put the question board away. But I'm going to ask about the 2 opposites. I guess the first one is I've been told that I've brushed my teeth too much.
Yeah.
And I'm guessing that's scraping away some of that stuff. So you can brush your teeth too much at times.
Now, I'm going to change your language a little bit.
Okay.
I think someone said to you too hard.
Okay.
Not too much.
That probably was it, yes.
Yes. Now, that is true. In the old days, when you probably still can, but you could buy toothbrushes with bristles that were like nails, friggin'
wire brushes.
Wire brushes, yes. Please don't ever do that. Certainly buy down the soft end of the bristle department, right? where your gum meets your tooth, that area, the crystalline structure, what we call enamel, comes to an end, and the root surface, which is much softer, starts. So if you're being brutal, brushing with force at that little margin, you can start to do damage to your teeth. Also, obviously, if you use a wire brush, God forgive, don't do that. If you use, hard bristles, you can also do that damage as well. So that's probably what your clinician was telling you.
Yeah.
Don't be so forceful. And, the art in that also is often people at the corner, your teeth are sort of in a curve because they're going in straight lines with their brush. At the corner gets a hit harder than the rest. So just be careful at the corner that you're not being a bit forceful on your teeth.
Okay.
That's the trick with that. So that's the first one. Go on. What was the second one?
Well, the second one is on the opposite end where gum disease.
Yeah, that's
the last time I was speaking to the dentist, she talked about 80% of people have this gum disease.
That's right. Oh. Where to start?
Yes.
Firstly, gum disease comes in two types. One is called gingivitis and one is called periodontitis. Okay? So there's two subtypes of gum disease. Gum disease has no pain associated with it until you get to real significant stuff. So it can just happen. Gingivitis is often can be a precursive signal to, you could move towards the other disease, periodontitis. Both are caused by the plaque story. So the plaque story is in this up to its knees, up to its neck, let's say. It's on the decay story. It's on, the two subtypes of gum disease. So, the general principle here is get rid of plaque, right? The 80% of people suffer gum disease. Probably that's including the people who have the gingivitis version, which is not as damaging as the periodontitis version. Now, once the periodontitis version, that's in the old days, you would have heard the saying, growing long in the tooth. Have you ever heard that saying?
No. Actually, yeah, I think I might have. Yeah.
Growing long in the tooth was a saying of generations before even me.
Yeah.
My grandma would say, oh, they're growing long in the tooth. And it was a saying of getting age or getting of wisdom, getting older. In fact, what they were describing was periodontitis. The attachment of the gum and bone to the tooth was receding either downwards in the lower jaw and upwards in the upper jaw. So the teeth were looking longer.
Right.
And in those generations, it was just taken on assumption that that's what's going to happen to you because they didn't have all the understanding of keeping teeth clean and optimizing the health. So they had this saying, growing long in the tooth was almost a coming of wisdom. No, it was a disease. Don't do it. Keep your teeth clean. And so periodontitis can be significant. The attachment of your tooth can recede and your tooth can get loose, and then, it also couples down because, as the attachment gets recedes, more plaque can get on the teeth as well. And, it just becomes more and more complicated. So if your clinician says to you, you've got some gum disease and, maybe we send you to an expert in that field called a periodontist, go. Find out what you need to do to keep those surfaces where that gum disease has started clean. Now, the 80% story is probably mostly the gingivitis story, which some good brushing will keep at bay. So keep brushing your teeth.
Where can this lead to with oral health? Like if you had really poor oral health, that affects the whole body event, doesn't it?
Obviously, it's infective. It's bacteria. So all of the story of bacteria. You know, you start to pus, big swell on faces like this, having to go into operating theatres to drain the pus out of your face. You know, like we can talk horror stories if you like here. It's
I'm already quite horrified.
It's dramatic. So let's stop, you know, in that sense. Yes, there are, and, you know, that there's, believe it or not, there would be a number of people in hospital right now with that problem. Caused purely out of not looking after teeth, you know, in ICU, having pus drained from their face. So, you know, the simple answer is, you know, it is ridiculously simple. Brush your teeth.
What about that, like before you're hospitalized, but you've got like an unhealthy oral health? Does that have flow-on effects to the rest of your health?
Well, you know, there's been some discussion about that, and you know, there's discussion about, you know, poor gum disease can result in cardiovascular disease, for example. Now, the science is still, there's not a clear causation in that science yet. So there are some associations at large scale numbers when you, you know, look at it. It's probably an association around inflammatory factors. So we don't have a causation to that story. So please don't, let's not all run off and have a panic attack that your gum disease is causing your heart attack. The data doesn't yet tell us that. But yes, there's inflammatory factors from inflammation. You know, we should be minimising the amount of inflammation we have. That's why we treat a cut on our arm, or, you know, use a bit of, I'll be old-fashioned now, I'm not even sure if you still use it, mercurochrome or whatever, you know.
Actually, I've not heard of that before. So,
okay. Well, I hope we're not using it then. Yeah, we shouldn't, you know, we should be minimising the amount of infection we have. That's a good, healthy principle. Yep.
So does it influence like the digestive systems or way that you take up nutrients, or like at all? I'm just sort of thinking it broadly here, but
I don't have any science to say yes to that.
Okay.
But what I would say is, we know when you mess with someone's inflammatory markers, when we mess with their, when we increase the amount of inflammatory proteins and things flowing around us, it's not healthy. On a sequence of fronts, gut health, it's just not healthy. So minimising inflammation, minimising infection should be a basic tenet of life, frankly. Yeah.
I mentioned earlier, and you said we'll put it aside. Mouthwash.
Mouthwash.
Actually, these aren't even questions.
This is really good timing now, because we've done gum disease.
Yeah.
There are some instances where we recommend a particular type of mouthwash, which has what we call chlorhexidine in it, and that is used in some of the treatment models around periodontitis. Now let's get to the general mouthwashes. That's not what you were talking about. You were talking about go to the shop and buy some mouthwash. Does that help? Well, it might to some extent, but I'm boring. This is the most boring podcast you've ever listened to, because the answer is going to be the same. Just get the plaque off.
Okay.
Get the plaque off.
I don't think it's that boring. I've been fascinated.
Does mouthwash assist you in getting the plaque off? Well, to some extent, but not at the same effectiveness of getting out a brush, or, you know, like my dad, sticking some coal dust. Get it off, you know. Also be aware, some mouth rinses, you know, have alcohol in them. Like big amounts, like banned in prison amounts, sort of things. So, you know, just be aware of alcohol and mouth rinses as well.
I was using an alcohol one for a while because it sort of just felt like my mouth was like super clean.
It absolutely does. Well, that's what alcohol does too. You know, it dehydrates the surface, so it feels like amazing.
And that's getting rid of the saliva?
for a small
Zero.
moment of time.
Okay.
That's not an issue. But brush your teeth.
Okay. Keep going, but keep circling back
boring.
to it.
Key message, man.
Yeah. Well, it is the main message. I grew up drinking rainwater.
Yep.
And
Nice
then when I've
question.
moved to Perth,
Yep.
started drinking tap water.
Yep.
I know lots of people drink bottled water.
Bottled water.
Yeah.
Good
Is this a
question.
toothly friendly drink?
Well, we're going to put it complete. I'll probably get into trouble with my dental colleagues to say this, but well, you would have heard the saying peak oil. Peak oil in the world. We've come to the top of the usage of oil products.
Mhm.
Peak oil. We've come to peak fizzy drink
Mm.
in the last decade. About 8 years ago, we came to peak fizzy drink. This is US data.
Mm-hmm.
Now, fizzy drink is masses amount of sugar. Now, masses amount of sugar feeds the bacteria and plaque, so they produce more acid. So that's why dentists have a thing about sugar. It's just it's like caviar to bacteria. Thank you very much. So coming to peak fizzy drink, with the advent of bottled water now taking some of the top off the amount of fizzy drink we drink, people are changing to using bottled water. I would propose is a very good thing. I would propose it's a very good thing because it might help us diminish some of the diabetes effect and the effect of massive sugar intakes that we all are doing at the moment. So put teeth aside, I think it's a positive construct. Some dental public health practitioners go, oh, but Mark, bottled water doesn't have fluoride in it. Well, actually, I'd rather people substitute fizzy drink for bottled water. So,
But if you were just to drink normal water,
go for it.
Tap water would be
fantastic.
Does rainwater have fluoride in it? Is there natural?
No. Well water from the ground will sometimes, depending on the rock you get it from.
Yeah.
Yeah. So well water will. Rainwater doesn't. Certainly tap water is highly managed, highly regulated, and absolutely drinkable in this country. Why people, I'm probably going to get into trouble for this, but why people would pay $6 million for a bottle of water in a country with water like tap water like most of Australia has, I just, having worked in countries where, water contains salmonella and all sorts of things, you need to keep your mouth closed while you have a shower and stuff like that. We are very blessed with the public health initiatives to keep our water safe here. I'm pleased it's cheap, drink it. Buy a flashy water bottle, put tap water in it and pretend if it's a social construct that you want to drink flashy water. It would be my view.
Interesting. I going back to the sugar and fizzy drink, I just got back from sailing through French Polynesia and we were on one of some of the most remote islands in the world and we're there for one of their national days.
Yeah.
And they put on like a little festival kind of thing. Like the town was only probably about 50 people, 60 people anyway, but they had all the kids there and they gave them all a bag of fairy floss, a can of soft drink, a very sweet muffin, and a spring roll. I can't imagine that's at all good for the teeth.
Yeah, but you know what? It was a festival day.
True.
So come on. I like lollies as well.
Yeah.
So let's, But if that was every day of the week, every day of the year, I'd be going, well, hang on, can we throttle back here? But if it's for a festival day, I often public health people become quite like you've joined the military sort of thing. And I think, you've got to have some.
Got to live a little.
Yeah. And a personal tip, I like lollies.
Mm-hmm.
I like lollies. But how do you eat lollies to optimize your dental health? Pretty simple, really. Eat them. Get them down as fast as you can. Get the bag down. If that's what you're going to eat, the whole bag, finish it. Just finish it.
Okay.
Don't have one lolly now. I'll time myself half an hour. I'll have another one. Don't do that. That's the worst thing you can do for your dental health. If you want to eat a packet of lollies, put them down on the table.
Inhale them.
And finish the bag.
Yeah.
Because what that does, the acidity in your mouth, with the sugar intake, the acidity will rise. Okay.
Mm-hmm.
It will rise, and then it will take time to taper back down. Okay, if you're going to binge them down in one burst, it'll rise, and then it will fall back down to safe levels. But if you take one every half an hour, rise, start to drop, rise, start to drop, you're just piling on the acid exposure over a longer period of time. So please, if you're like me, you like a packet of lollies, you buy your packet of lollies, you sit yourself on the park bench and you go, I'm getting these down and finish them.
So sugar is the worst thing for our teeth, is it? Is that the worst food?
Worst food?
Well,
yeah,
I guess in drinks as well, worse.
Sugar just feeds the bacteria. Sugar is caviar to the bacteria involved. That just produces acid. So yes would be the answer to that. Now, I also want to point out my idea of promoting lollies as binge eating does go contra to the diabetes story and all the other health pieces of having high sugar intake diets. So please, I do believe in diminishing sugar intake. I'm not crazy, but if the effect takes hold of you,
yeah. I think everyone understands the sensibility.
Yeah, good.
of where we're coming from.
Good.
What about carbonated water, like soda waters, and we've all got.
Yeah, well, some of those are it's not to the same level as the can of fizzy drinks. 14 teaspoons of sugar.
It's a lot.
14. You pile 14 teaspoons out on the table and have a look. Would you eat that? No. So
as a kid, I would have. But
yeah, but put that there. Carbonated drinks, obviously they have carbonation causes some acidity. So they are somewhat acidic in their own form. So there is some effect directly of that acidity on the crystalline structure of the outer coat of your teeth. So, please don't sit there with bottles of that, 24/7 sipping away at carbonated drinks. That will not do your teeth any good at all. But obviously, on the scale of badness, that's not up there with sugar feeding.
Okay, but it's interesting. Yeah, very small amount, but that's quite interesting because I recently just acquired a Soda Stream to spice up my water a little bit, and always wondered if it was like
it's not
something.
It's not fall off a cliff stuff, but don't go as your total alternative to water. Yeah.
What about like the the like Coke Zeros or the Pepsi Max that don't have sugar?
Yeah, but they're carbonated.
So okay,
they still have their effect.
Just a higher level of acidity too.
Yeah. And their acidity, if I remember rightly, is higher than the, make your own stuff. So,
yeah, I think there's a whole bunch of other things in there that we probably should be quite careful of.
Yeah.
I'm going to completely switch topic for a little bit. Well, not topic, still on the mouth. I've heard about cleft palate. I've seen cleft palate.
Yep.
Who looks after the people with those severe conditions?
That's a really good question because, obviously many people will know people around them. Cleft lip and cleft palate are good examples. They range at about 1 in 800, 1 in 1,000 births in this country. But there's all sorts of other conditions as well, genetic conditions. I'll name one, amelogenesis imperfecta. Some people may have seen the related condition, osteogenesis imperfecta. Sadly on TV you often see this, children who've had 400 fractures in the first 10 years of their life, or those sorts of case examples are on the news and things. They often have the condition of osteogenesis imperfecta, which is also amelogenesis imperfecta in that mix. So there's a bunch of these not common, but not crazily uncommon conditions that kids can be born with, genetic conditions and things. In countries like Australia, we have systems to look after those people. They are not left to find a dentist to look after your cleft palate. We have in West Australia, we have a single united service out of the kids' hospital that their care will be wherever they're born in Western Australia, they will be flown with their family to Perth immediately to commence care of that infant and treatment of, talking cleft lips and cleft palates. That treatment lasts 20 years. Their entire childhood, they will be having treatment to correct that now. So we have systems. It's not like, please, if you're a parent or a grandparent and all of a sudden you find out your kid has a cleft lip and palate, it's not a time to panic. You're not, we have tremendous care. In fact, the care out of West Australia is seen as some of the best in the world for cleft lip and palates. And single united services like that, you're obviously seeing them for all sorts of conditions now, cancer treatment centres, those core centres where we provide care really get the optimum clinicians together in the optimum environment to make optimum care decisions for those kids. So, the other part I'll say, care now for cleft lip and palates people is phenomenally good. Non-clinically trained people will walk past patients and not even work out that they are a cleft lip and palate person. In fact, you could well be a cleft palate or cleft lip person. I would
not know,
particularly because one of the things we say for males is have a moustache, because that'll cover up the tiny little scar that clinical people like me can often pick. As we go to the supermarket or something, oh, gotcha.
Yeah.
Whereas I don't obviously do that to people. But mentally, I go, gotcha. And but the treatment now is phenomenal. You would not know, and I say this to, families, please, if you have a little one, all of a sudden you find out after their birth they're cleft lip and palate, when you first meet them, you'll be scared. You'll be confronted by what you see. But the treatment now, in 2 years' time, you'll look at what was, and the treatment is amazing. We are a completely different world now. So.
On that note of the future directions, is obviously there's a lot more technology just constantly rapidly changing.
Yeah.
What are we going to be seeing? If you can give us some future predictions, where is this going? Where are we going with the future of dentistry?
Yeah.
Is AI making an appearance in this?
Yeah.
Can we fix teeth?
Yeah.
Or instead of filling them in, or
what a series of great questions, and the reality of yes, technology is making an amazing difference. The best example I can give of my lifetime. I started dental school, mid-80s. And at that point in time, an orthopaedic surgeon in Sweden, I beg your pardon, invented, by serendipitous chance, a mechanism of integrating metal to bone, osseointegration. Right. So not only does it not like a screw, just physically held in, but bind it to bone. And he used dental as the test case.
Oh, really?
So, and to be honest, it's been probably one of the biggest technological advances of my time in dental. This is osseointegrated implants, or screw-in teeth, as some people might call them. If you lose a tooth, you can have a piece of this metal used to integrate with the bone of your jaw and then build a tooth on top of it. Artificial tooth. No more false teeth.
Wow.
So, that's a near history exemplar of the technological advances. What we see now in the technological advances is a lot of the radiological techniques and things, our ability to diagnose. Certainly we're now seeing, the use of AI to be better than people like me at reading x-rays and finding problems and, analysing where we should go to treat and things. So, AI is coming full bore into that diagnostic part of dental. We just look at the medical side of that. AI in reading radiographs now is up there with the best of human readers, somewhat better in some cases, some diseases. So, that's coming. So that is going to be a phenomenal shift, technologically speaking. Regrowing teeth, that's a common one I'm asked about. Can we get over this filling thing, Mark, and paint some stuff on that make a tooth regrow?
Yeah, so you just mentioned the structure is crystalline structure.
That's right.
But what is it?
Well, it's hydroxyapatite is the technical name. It's a mixture. Look.
What sort of do we have any out of that in our bodies? Or is it only the teeth?
Just the surface of your teeth, just the enamel surface of your teeth. Now, I'm going to cut to the chase on this first. It's an extraordinarily complicated structure, teeth. You've got these perfectly arranged crystalline structures, and it's not like a quartz crystal. It's not just a straight piece of crystal. It's this beautiful arrangement, and then that's coupled and stuck to an cellular underlay, a foundation. But even the boundary is beautifully arranged to maximize the attachment of the high tensile to the soft flexible. That's a very complicated engineering problem to have those two attached. Something that's very rigid to something that has some give in it. I think the idea of regrowing teeth is still a long way off.
Okay.
It is, because it's from many different embryological origins, the tissues, the cellular part of that deal of how a tooth grows. It's not just one cell just does the job and builds it and it's there and it's a cube or something. It's, thousands of genes expressed over a sequence of time. It's extraordinarily complicated. So I'm sorry. I think the journey about instant regrowing teeth is a little way off. I think the technology of the materials we use to do fillings is, even in my lifetime, that a phenomenal change in material size.
Yeah, because you don't really see silver or gold fillings or anything anymore either.
No, you see some of them. I've got a couple of the old silver ones in me.
Well, so you still see them, but they don't happen as much anymore.
They don't happen as much. No. You're right. New materials have come along. And a clinician looks at a hole in a tooth and goes, what's the optimum material now? Because they've got this whole suite of materials. You're not just got one material, everything must be fixed with X. You've got this suite of materials that you can pick the right material for the right problem in the right person now. So I think we'll see a lot more of that. We'll see advances in materials, advances in how we can stick fillings onto teeth. That's obviously a tricky problem as well. So there's huge advances will come on that journey. I just want to say it again.
Brush your teeth, remove the plaque.
Thank you, mate. Keep what you've got.
Yeah.
Keep what you've got. That enamel on your teeth, you get it once while you're an embryo, while developing, and that's it for life. The cells that grew that crystalline structure on the surface of your teeth are gone.
Oh, no way.
They do not exist in you today. So please, be kind to it. It's going to last you 100 years.
Yeah.
Look after it.
Is that the take-home messages?
Yeah.
Yeah. Remove the plaque.
Just remove the plaque, and don't just do it simply. Count to 8, clean properly, and if there's a problem, go and see someone. That's the other little trick in this journey. Decay, gum disease, they're chronic, so they get worse with time. Just go and see someone. Your first thought of, that looks a bit weird, or, it's a lot easier. You know what? I'll put it another way. If you don't want trauma at the dentist, I'll tell you the answer to that. Go regularly. Because if you can get it before it's a problem, it's going to be easy. But if you let it go, I'll wait, I don't like the dentist, I'll go, in 6 months' time, I'll go another year's time. As the chronic disease gets worse, it's going to be more traumatic to treat. So the art...
I hear crazy stories of some people saying they haven't been to the dentist in like 20 years. Like I'm a person that goes every 6 months.
Yep. I should talk that through for 1 minute. There's no right answer to that. Right. In the old days, people said you must go every 6 months. No, it's horses for courses. And you talk to your clinician, and between you decide how long between visits you should have.
Okay.
20 years is ridiculous.
Yeah.
So let that go. But, it's not. You don't have to go every 6 months. Your clinician will go to you, look, you look after your teeth well, you get the plaque off, for one of my message again. You've got no decay, your gums are looking healthy. Let's leave it 18 months before you come back. You have that discussion with your clinician to decide what's the optimum recall rate. Please don't just be stuck on they said I must go every 6 months. Don't.
Okay.
I'm a pretty military individual, but that's not on my military list.
Yeah. Thank you so much for coming in today. This has been mind-blowing. I know you're a very busy man, got a lot of things on your plate. So, yeah, this has been absolutely an awesome experience to learn some things, and I hope everyone has learnt a lot of things, especially hopefully they've learnt to remove the plaque. That's the main message.
And if you're going to eat lollies, blitz them.
Yes, yeah, that one too.
But yeah, no, look, a great pleasure. I thoroughly enjoyed the day. Nice to meet and nice to share some stories. Thank you.
Thank you.
Hey guys, just before we wrap up, if you'd like to support the show, please check out our merch at ParamountImportance.com. We have made sure we've gone for the highest quality and most environmentally friendly options we can go. It would mean a lot to us. So thank you, and we'll see you at the next episode. Paramount Importance.